Our goal is, and we talk about that often, is that to make big, we're a big health system, feel small to the individual that is experiencing it. That's our number one challenge and our number one goal. Healthcare is all about the relationships that we have, and the relationships we build through the connections that we have with our communities, with our patients, with each other.
Hello, this is Rob Hoyle. Thanks for joining us on Northwell Health's 20-minute health talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm alongside my co-host, Chris Gazewski, and today our special guest is Sven Gierlinger. Sven is a Senior Vice President and Chief Experience Officer at Northwell Health. Sven, thank you so much for joining us. You talk about experience, making people's hospital stays more comfortable. Kind of difficult to do now in this age of COVID. How do we do it?
It definitely is. But first of all, thank you for having me on the program here. And you said brightest mind, so I'm not sure if I'm in the right room right now.
You certainly are.
Maybe I should leave. So, it's definitely more challenging during COVID because we have a very different set of circumstances. Families can't come into the hospitals, or at first it was cut off. Then we opened visitation again. Now we're also limited again. We haven't completely closed it, but. As we all know, there were some tragic events that were happening in the hospital, and not having family members by the bedside was difficult. But the family members and everybody was very understanding and very supportive of the staff. So but it's not just the inpatient experience that has changed; it's the ambulatory experience that has changed too. If we think about how quickly we have to stand up telehealth because we couldn't go physically to a physician office, and we've heard all the care that has been delayed, etc., as a result of that, and now we've really caught up with that. And now the goal is, with the surge that we're in, to maintain those operations and to make sure that we can still deliver the care that our community needs.
It was like one big fire drill after the other back then in March and April.
Yeah.
Take us back there. What was it like from you trying to figure things out on the fly and just try to provide the best experience?
Well, I like to think of it as a tsunami, right? You saw this wave coming, and then all of a sudden it just completely enveloped us. So we were, it changed so quickly from day to day, and the biggest change was really the visitor restrictions. The hospitalizations were rising on a daily basis. I remember when it was when we had a few hundred, and what a big deal that was, and how I've been in constant communication with the patient experience leaders at all the hospitals. We had calls set up every other day, and they were starting to get overwhelmed with the patient volume and with the acuity of patients, and then it just went into over 1,000, then it was 2,000, then it was 3,000, and then we really, April 7th, I believe, was the day we had the highest hospitalizations. It was despair. It really was very difficult for everybody to live through that, But the teamwork that has happened during that time, and the collaboration, everybody working together at the hospitals, people being reassigned, redeployed, the shared services departments working together. I always felt like the titles went away, the red tape went away. We just everybody worked together for one common cause, and that is to save as many lives as possible. Now, we lost a lot of lives, unfortunately, but we saved so many more. And just those celebrations of every life that was saved. And there was a big moment also when the codes in the hospitals became so overwhelming for the staff, and every time they hear code blue, and they were just running from one side to another, that it had such an emotional impact on them, and it was very, very depressing for them that we had to balance that with positive messaging. And that's when the idea came up to play a song every time actually somebody was extubated or was discharged from the hospital, and then people were dancing because we saved another life, and we played "Here Comes the Sun" from the Beatles.
That's kind of the experience that a lot of hospitals and health systems are going through right now. Resurgence, or even going through their first wave. I saw some statistics. I think South Dakota has 1 in 3 people have COVID right now in the whole entire state, which is astronomical.
Yeah.
We're also seeing an uptick here too.
Yeah, and that's the difference now that the whole country is experiencing this at the same time. Before it was just us, or it started in Washington State. They didn't experience the levels that we did, and then we were hit with that tsunami. But now it's every state is impacted by it, and we actually are considering the population. We're handling it actually pretty well at this point.
Yeah, I think we've learned so much, which is making it a little bit easier. Would you say it's easier this time around?
In a way it is, but it's also difficult. We are more experienced, but we have the experience. So just that thought that we could be back there again, where it was so overwhelming, that is very taxing for the employees. So there's definitely a lot of anxiety around that.
Is there anything that worked in the spring, or we learned and implemented in the spring that we're carrying through to now in terms of patient experience?
I think everything that we've learned, how to maintain the family connections. We have roles identified that go into the patient rooms to facilitate those discussions and call the family member, schedule time so that they can see each other. Yeah. And then also often the clinician gets involved there too, and they can talk to the doctor or the nurse and see what's going on.
That's the scariest thing, I think, during, anything, is this not knowing and not being able to see your loved one, not being able to go visit them. But then you have an iPad and you could see your loved one, and what the doctor maybe told you now makes more sense because you're seeing it and you have the doctor there. Right. Something that small, the technology part, I guess
it's huge. But what's so interesting is, and I think that's a lesson learned, is that the human touch cannot be replaced, right? Yeah. And what the staff did, and what they're still doing, is they become the family member, and they were asking the family on the other side, what do you want me to do? Do you want me to stroke their head? Do you want me to hold their hand? Do you want me to? They became the family, and something really profound happened the other day when we do these. It's called Schwartz rounds at the hospitals. Whenever a traumatic event happens, then it's a very organized debrief. It usually happens during lunchtime. It's an hour. All the people that were involved in that incident come together, and they share their experience. And it's very healing and just processing that whole event. And one of the nurses at one of the hospitals recently said, I try to log into as many as possible because it gives you a really great connection to what's happening. And she said, we always try to be the best caregiver, the best nurse, the best doctor we can be. But we also had to be the best family member we can be. And that was such a profound statement, I think.
Yeah. I mean, the way clinical staff reacted and adapted is amazing, because they went from caregiver to communicator to IT person.
Yeah, everything. I think all of our roles changed, and everybody had to think, what can I do to help the greater good, and to develop kits that we've gave to COVID positive patients at the EDs to take care of themselves at home. And so we put tens of thousands of those kits together that we distributed. So we had a production line going on here at 2000 Marcus Avenue, all things that you just have to jump in and do them.
So what was in the kit?
Good question. We put in a few items that would be clinical. So we put a thermometer in there. We would put a pulse oximeter in there, but also instructions on how to isolate at home. Make sure that you measure at certain intervals, but then we put some feel-good items to as well. We put water into it as a symbol. You got to hydrate during this time. We put a recipe in there from our chef Bruno Tisson for chicken noodle soup for them to make it home and maybe try something new. We put some tea into it, and it was very, very well received.
It's awesome.
I think there was a Cliff Bar in there too.
Yes.
Nice.
Talk a little bit about the digital patient experience that we have here and how that is really, evolving.
So we're really trying to evolve our digital patient experience so that we have this balance between the human experience and the digital experience, borrowing from what other industries have done for quite some time now. If you think about banking, if you think about the airline industry, you can do everything yourself, right? You make your airline reservations, you check in over the phone, you can get your boarding pass. There's not much interaction that you can't do yourself. Same with banking. Who would have thought that you would transfer money from your phone, right? Or that at some point we were able to deposit checks, et cetera, things we always thought we would need to go into place. And I think we're going through that same evolution. Through digital technology, we're empowering the patients to do what they can themselves, and so that we can focus on the medical care, on the clinical care, and bring and to foster those human connections. And that's everything from making an appointment. Our goal is to have self-scheduling, where the patients can actually schedule directly with that physician, where they don't have to call a call center, where they don't have to be on hold, leave a message, wait for a call back, because time is precious. And we definitely recognize that and want to make sure that our patients are empowered to do that, but then also to have access to information, to be able to pay your bill easily, and most importantly, that we store all the information in one place. I mean, it's very frustrating to all of us when we have to fill out reams of paper when we register for an appointment, right? And you feel like you have given that information 50 times, and you probably have. And those are the frustrations that we want to take out of. I like to always talk about that we want to make it as effortless as possible, to create an effortless experience for our patients, because we've done some research around that. So last year we went through an exercise where we sat down with patients. We hired an experienced design firm, and we did interviews with patients where we sat down in their homes, at their kitchen table, on the living room floor, at the dining room table, and asked them what they think patient-centered means. And then they told us 5 things. And the first one was partner with me. Make sure that we are an ally, that we do this together, that I like to have input into my patient, into my care experience as a patient. The second one was personalize the communication. I'm not a number, and it's exactly what I just talked about. Make sure that you keep the information about me on file. The third one is set expectations and follow through. That we under-promise but over-deliver. That we don't promise something that we can't follow through on. The fourth one was help me with the next step in my care experience, because it's always that handoff to the next thing. That we don't just say, here, you got to see the specialist, but help them with making that appointment. We always know what the next step is, so we need to be proactive there. And the fifth one is really interesting, because that's about access, and we call it's about access, because we often think about access as access to appointments, right? When we talk about that. Patients definitely think about that too, but they also think about the access to people, the access to the practice, the access to the physician, so that when I call, I can get a hold of somebody there and they can answer my question, and the access to information, so that it's easy for them to get the medical record, to get all these things. So that if we do that, then we take the headache out of it for patients, and we'll be much better off. And we have a lot of initiatives on the way.
In terms of COVID, you and I had talked a while ago about a new pilot, and just to avoid large crowds inside these ambulatory practices. Are we still text messaging people when, not to come, stay at your home for another 10 minutes or whatever? Maybe.
So that's one of those projects actually that we can text message somebody, like when your airplane is delayed. Same thing that we're running behind. It happens. Physicians are now behind, but now we can text them and say, you can do something else with that hour. You don't leave yet. Also very important is when they get there in the clinic, we tell them to we'll text us when they're there, then we'll communicate with them when the provider is ready. They stay in the car, they come up to the clinic. almost go straight to the exam room, and we cut out all that time. And especially right now, safety is a huge concern. So we're bypassing the waiting room, which, by the way, waiting rooms...
It's got to be the biggest complaint.
Yeah, and waiting rooms are the biggest waste of real estate in healthcare. I've always said that. If you think about it, if we could... Why do we have waiting designed into the process? Tell me other businesses. Yeah, maybe airlines. Yeah, airports have that, but they have to. You don't have a waiting room in a hotel where you're waiting for your room. So that just tells you that we got to get a lot better about that.
Yeah, what we want to transition now to is a new segment that we're going to try out. What exactly is keeping you up at night these days?
It's the stuff that happens outside of the medical care that keeps me up at night, what I talked about earlier. It's how difficult it is for patients still, and we're not alone in that, to navigate the healthcare system, and that's why that's a huge priority.
Even just to scale some of these initiatives got to be pretty challenging too.
Yes, scale is definitely something that we have unique challenges with because of the size. But that's an important point, because our goal is, and we talk about that often, is that to make we're a big health system, feel small to the individual that is experiencing it. And that's our number one challenge and our number one goal. Healthcare is all about the relationships that we have, and the relationships we build through the connections that we have with our communities, with our patients, with each other.
Yeah, so we'll move on to our next segment called Kneejerk Reactions. So what we're going to do is we're going to say a word or a phrase, and we really just want to get your reaction to it.
Okay, bring it on.
Here we go. Love the enthusiasm. Reimagining the patient experience.
Is hugely important and is about having compassionate care and taking away the frictions, like I said earlier.
Communication
is paramount, and we have to make sure that we are doing that in an empathic way, and that we build the relationship through the communication that we have and personalize the communication.
Care access and coordination.
Access is not just about access to appointments, and it is important that we help our patients coordinate their care. We are the experts at that, and we need to make sure that we help them with that.
You touched on this earlier, working as a team.
Teamwork is one of our organizational values, and I've never seen more teamwork than I have over the last 9 months, I would say, in my entire life, in my entire career.
Yeah, it's here to stay.
Yeah.
Disruption.
Disruption is good. Disruption, we have been disrupted in enormous ways, and disruption forces us to innovate. It forces us to think differently, and it is also making us better.
Putting patients first.
We used to be a provider-centric industry. Now we've swung the pendulum to making sure that we put the patient in the center of what we do. It's in our mission statement. In our mission statement, we talk about world-class service and patient-centered care. There you have it.
COVID-19.
Changed us forever. Changed us as a nation, as a world. Changed us as an organization. Changed us as individuals. And it will, as hard as it is to go through right now, I think we'll be better off in the future.
That's a perfect segue into our last segment, which is we always like to end on a positive note. So tell us what gives you hope.
It's the human spirit working together that I think gives me so much hope, and that has been present throughout this entire journey. And I think we've learned a lot over the last 9 months as people, as humans, in what's important, and that will have lasting effects for us. And what we've learned clinically, what we've learned in how to treat patients, with COVID. Also, one statement that I learned recently from one of the Schwartz rounds, where I think it was a physician actually, no, it was a nurse, I'm sorry, who said it is less about charting and more about caring now. And that has stayed with her and with the team. And that's a beautiful statement.
It's awesome. Well, Sven Gierlinger, thank you so much for joining us on 20 Minute Health Talk. And for everybody who tuned in, thank you and have a great week and stay safe.
Get more expert insights from some of the leading voices in healthcare today. Subscribe to 20 Minute Health Talk on Podbean, Pandora, Spotify, iTunes, and wherever you get your podcasts.